In this video, we're going to do some myofascial self-help exercises to help with breathing. There's lots of different reasons why people may have breathing issues. So it could be a short-term issue such as an infection or a virus. So for example, bronchitis or flu or COVID. Or it could be a longer condition that people have. So for example, COPD, emphysema, long COVID or asthma. Whatever the reason, when you have breathing issues, it changes how you breathe. And so you can go from deeper lung diaphragmatic breathing, which is in the bottom of your rib cage, to shallower breathing in the top of your ribs, where you start to use muscles that you wouldn't normally use in breathing, for example, in your neck. When this happens, you can get into a bit of a cycle where the breathing becomes more difficult, and the more this happens, the more you struggle to breathe, and so on. So these exercises that we're going to do are designed to help to start to release some of the areas that may have become tight due to the breathing issues. Done regularly, they can help to alleviate some of the breathing restrictions. And also we've got a nice towel stretch as part of the exercises, which helps to relax all of your body and your nervous system. In this exercise, we're going to use a ball on the side of the neck. So to do this, I'm going to lie on my side and I'm going to place the ball on the side of my neck here. So it's important to make sure that the ball is far enough back so that it's just underneath your ear and not too far forwards, which will be uncomfortable. So when you're here on your side, it's a good idea to pull your bottom arm forwards so that your shoulder is out of the way. And this means that you can feel a firm pressure from the ball on the side of your neck. If it helps, you can put a small pillow or a yoga block underneath your head just to make things more comfortable. So working here is really important if you've had any breathing issues, because difficulty with breathing means that you take more shallow breaths, and that means that you breathe into the top of your chest and your ribs instead of breathing into the bottom of your lungs and your diaphragm, which is normal relaxed breathing. So if you've been breathing into the top of your chest, you will have been using what are known as accessory muscles. So these are the muscles in the side of your neck. They're called the scalenes, and they run from the side of your neck down under your collarbone and attach into the first and second ribs. So if you're using these muscles as part of your efforts to breathe, then they can become tight. And sometimes when they become tight, this can create a pattern of other symptoms such as tingling and pain that comes down into your arms and your hands. And this is because your arm nerves come out from your spinal cord through the scalene muscles on their way to your arms. So working here with a ball can help to release these restrictions. It helps to soften your breathing, and it can help to alleviate any other symptoms that you may have been noticing. And as long as you're here for at least a couple of minutes, then the tissues will be starting to release and let go. And so now I'm going to do this exercise on the other side. So on this side, also pulling your bottom arm forwards to make sure that your shoulder is out of the way, so that you can feel some pressure from the ball onto your neck. And if it's uncomfortable to do this exercise on the floor, then you can do this on your bed. Whatever feels good for you. So while you're here, just noticing what you feel. When you shallow breathe, then your top of your rib cage becomes tight. The muscles around your neck and your shoulders become tight because they are involved in breathing, which is not something that they normally do. Also, between each of your ribs are little muscles called the intercostals. They help your rib cage to move as you breathe. And again, if you've been having difficulty breathing, then these muscles can also become tight and restrict the movement of your rib cage. So starting by releasing the scalene muscles can take some of the pressure off the top ribs and can start to help with deeper breathing down into the rest of your lungs. And as long as you're here for at least a couple of minutes, then the fascia will be starting to release and let go. And as it does, this takes the pressure off the scalenes, it takes the pressure off your arm nerves, and it takes the pressure off the top of your rib cage. In the last exercise, we used a ball to release the side of the neck. Another way that you can do this is by doing a neck stretch. So it's a nice simple stretch that you can do either seated or standing, whichever is more comfortable for you. I'm going to start by just having my arms relaxed by my sides and just letting my shoulders go heavy. And then I'm going to tilt my head over to the side until I start to feel my ear coming towards my shoulder. So as I do this, it's important to keep my shoulders relaxed and heavy. Sometimes when people do this, they start to bring their shoulder up with them as they go into the stretch like this. And then that just defeats the purpose of the stretch. So by keeping your shoulders nice and relaxed, you should start to feel a stretch into the side of your neck. And this may travel into different parts of your body. So depending on your restriction pattern, you might feel it more in your neck, or your head, or your shoulder, or your arm, or somewhere else. And wherever you feel it, that's fine for you. And making sure with this stretch that you only go as far as is comfortable. As soon as you start to feel a restriction, so not pain, just a restriction, you wait. And you wait for a sense of the tissues softening, elongating. And then you might find that you can go into slightly deeper stretch. And this pattern may happen several times during the stretch. If you want to have a deeper stretch, then you can bring your arm up and place it on top of your head. So with my hand on my head, I'm not pulling my head, I'm just allowing the weight of my hand and my arm to create a slightly deeper stretch into the side of my neck. So the great thing with myofascial stretches is that you only do each stretch once. And as long as you're here for at least a couple of minutes, then the fascia, the muscles will all be starting to release and let go. So then coming out of this stretch, I can just roll my shoulders, Turn my head from side to side. And then we can do the stretch on the other side. So again, keeping my shoulders nice and heavy, I'm just tipping my head over to the side so that my ear starts to come towards my shoulder. And only going as far as feels comfortable in the stretch. As soon as you feel any restriction, which you might feel in your neck or your shoulder, you just wait and wait for a sense of the tissue starting to soften and release. This is a great stretch because it is helping to stretch out those scalene muscles and starting to loosen some of the tension that may have built up around the top of your rib cage. And the looser and more elastic your neck muscles are, in particular your scalenes, then the easier your breathing can become. And each time you start to feel things softening, you can go into slightly deeper stretch and progressively creating a lovely elongating stretch. And again, if you want to deepen the stretch even more, you can bring your hand up and place it on your head. Not pulling, just allowing the weight of my hand and my arm to create a slightly deeper stretch. And just noticing where you feel this stretch. It can be different for everybody. There's no right or wrong. It's just a matter of noticing what's going on with your body and where things are starting to release and let go. And as long as you're here for at least a couple of minutes, then the fascia will be starting to release, which reduces the tension in this whole area on the side of your neck. And then coming out of this stretch, again give your shoulders a little roll and turn your head from side to side. This just helps to assimilate the effects of the stretch into your body. In this exercise, we're going to do some work to release a muscle in the side of our neck. We've already released the scalenes, and now we're going to release another muscle that sits on top of them and is called the sternocleidomastoid, which is a bit of a mouthful, and it's normally known as SCM for short. But the name is good because it actually helps to explain where the muscle is, where it attaches into, and where it goes. So sterno is for sternum, which is your breastbone, which is here in the middle of your rib cage. Cleido is your clavicle or collarbone, which is just here. And then mastoid is the mastoid process, which you find just behind your ear, which is the bottom part of your skull. So sternocleidomastoid. And this muscle helps to turn your head from side to side. This is one on either side of your neck. However, if it becomes tight, then it restricts that movement in your neck. And when you have been having breathing issues, then you will have been doing a lot of shallow breathing and using the top of your rib cage and your neck muscles to help with your breathing. So if the sternocleidomastoid tightens, then that can restrict your breathing further. So working to actually release this can help to make your breathing easier and improve the range of movement in your neck. So we're going to work on the left side of the neck, and in order to do this I'm going to actually take my ear to the left, so it's coming towards my left shoulder, and then I'm going to turn my head to the left. So what this does is it helps to soften the sternocleidomastoid on the left side of my neck. And then I'm going to bring my right hand up across my body and take hold of the muscle between my fingers and my thumb. Now this can feel a bit weird when you first do it. It feels a bit like a greasy rope, and that is the muscle itself that you're feeling. All you're going to do is gently compress the muscle between your thumb and your fingers. So as long as you can still breathe and you can still talk, then you're in the right place. You're not affecting any other structures in the body or in your neck. You're just working on this muscle. And all you do is compress the muscle and wait for a sense of things softening. So this can feel quite tender, and you can feel quite a lot of points that are very tender, and these are what are called trigger points. And a trigger point is just a knot in the muscle and the fascia that has happened because everything has become tight and restricted. So as you release the trigger points, then the muscle can become more elastic and looser again. So when you've been on one point for a couple of minutes, you can release that, and then you can move to a different part of the muscle. So you can work anywhere that you can access, from behind your ear down towards the top of your rib cage. And just notice how things feel. And each time you're here, waiting on a specific point, just for a couple of minutes to allow time for the tissues to release and let go. So as you come out of this, once you've done a few points on one side, just turn your head from side to side, just to help assimilate the releases into your body. And then we can do the same thing on the right side. So I'm going to tilt my ear towards my right shoulder, and then I'm going to turn my head to the right. Again, this just loosens and softens the muscle on this side. And then I'm going to bring my left hand up across my chest to just grasp the muscle. Again, I'm just grasping the muscle between my fingers and my thumb, and just waiting for a sense of the tissues starting to soften. So it's not massaging, you don't have to increase or change the pressure at all. Just a nice, steady, gentle pressure will help to start to release areas of tension in this muscle. Sometimes when you work on the sternocleidomastoid like this, you might start to notice that you develop a bit of a headache. And this is quite common because trigger points here can actually be responsible for headaches. So if this happens, you can move on to another point, or if you'd like to alleviate the headache, you can just wait and you'll find that it will start to ease off as the trigger point releases. And once you've been here in one point for a couple of minutes, you can move on to another point. And so you can work along the muscle in different areas, releasing the tissues. So this is a good exercise to do maybe once a day, just for a few minutes. Tend not to overdo this exercise, because as I say, if you do too much, you can give yourself a headache, as opposed to working on a couple of trigger points and alleviating one. So then coming out of the exercise, turning your head from side to side again. And as you do this regularly, you'll start to notice that your movement in your neck becomes a lot easier. You can also do a chest stretch. A good way to do this is by using a doorway like this, and you can just place your hands either side of the door frame and then just take a step through. It doesn't matter which leg you lead with, and if you're doing this regularly, you can just change legs each time. The main thing is that you start to feel a stretch into your chest. So keeping your upper body upright but allowing your body to just lean through the doorway, you'll start to feel a stretch across your chest. And so this is just allowing the tissues, the muscle, the fascia to start to release and let go. And as the chest muscles and the fascia release, this starts to open out the rib cage, and it will help to give more space to the lungs and to make breathing feel easier. When you're here, you can have your hands in different position depending on which you feel works best for you. So for example, you might have your hands a bit higher up, or you might have them a bit lower down. You can experiment to find which hand position actually gives you the best sense of stretch in your chest. And as long as you're here for at least a couple of minutes, then the fascia will be starting to release and let go. In this exercise, we're going to do a towel stretch. So to do this, the best thing to use is a big towel like this. This is a bath sheet, and I'm going to roll this up into a sausage. So once I've got this rolled up, I'm going to lie on the towel on my back, and I'm going to make sure that I've got both my head and my bottom on the towel and my spine is along it. So when you're here, you can have your knees bent or you can have your legs flat, whichever is more comfortable for you. Have your arms out by your sides, maybe have your palms turned up towards the ceiling, which helps to open out your chest. And just allow your body to start to relax onto the towel. So this stretch you can do for longer, and I'd recommend anywhere between 5 and 15 minutes. So what this stretch does is, because it lifts your spine off the floor slightly, then gravity starts to pull everything back down. And as that happens, it opens out your body and the front. So it opens out your chest, your ribs, your abdominal area, your pelvis, and your legs. So from a breathing point of view, it's helping to open out your rib cage and relax your lungs, relax the diaphragm, which is the muscle that tucks in under the bottom of your rib cage. It helps to open out your chest muscles, and it helps to relax all of these areas and create an environment in your body where it becomes easier to breathe more deeply. From a nervous system point of view, this is also a good exercise to do if you're feeling stressed or anxious. The pressure from the towel on the base of your skull and the base of your spine helps to relax the part of your nervous system that's responsible for the rest and digest function. And as part of resting and digesting, it means that it encourages your vagus nerve to activate, and this helps to improve and relax your breathing. So there's lots going on with this stretch, even though all you're doing is relaxing on the toe. And while you're here, you might want to try some deep breathing. So to do this, if you place your hands on your lower rib cage, so your hands are half on the ribs and half on the top of your tummy. So here, start to notice what your ribs are doing under your hands. So as you breathe in, your ribs should move out and up. And as you breathe out, your ribs should move down and in. Breathing in, up and out, breathing out, down and in. So this is the natural pattern of breathing when you use your diaphragm and you use all of your lungs to breathe. So focusing on this movement of your hands and encouraging your breath to move your hands can help to improve your breathing. So even if you just do this for a few minutes, it starts to encourage your body to breathe more deeply, and this will help to improve relaxation in your body. You can find more myofascial self-help videos on our YouTube channel, and you can visit our website to get more information about myofascial release and to buy our myofascial release kits.